Understanding the struggle. What is BPD? Borderline personality disorder, commonly known as BPD, is a complex mental health condition that can deeply affect a person's life. Life can be a roller coaster of emotions, filled with ups and downs that everyone experiences. However, for those with BPD, these emotional highs and lows can be much more intense and unpredictable. We all experience highs and lows, but for some, these emotional swings can be extreme and disruptive. Imagine feeling emotions so intensely that they interfere with your daily life, relationships, and overall well-being. This is often the case with borderline personality disorder, or BPD for short. It's a condition that can make it difficult to maintain stable relationships and a consistent sense of self. BPD is a mental health condition that affects how you think, feel, and interact with others. It can lead to intense and unstable emotions, impulsive actions, and a distorted self-image. It's like having a hard time regulating your emotions, leading to intense feelings of sadness, anger, emptiness, or fear. These emotions can change rapidly, making it hard to predict how someone with BPD might feel from one moment to the next. Imagine a pot of water on the verge of boiling over. That's what it can feel like for someone with BPD. The emotional intensity can be overwhelming and difficult to manage. The slightest touch or change in temperature can send them into a spiral of intense emotions. This heightened sensitivity can make everyday situations feel like emotional minefields. But here's the good news. BPD is treatable, and with the right support, individuals can lead fulfilling and meaningful lives. Therapy, medication, and a strong support system can make a significant difference, helping those with BPD manage their symptoms and build healthier relationships. A journey through time. The history of BPD. Borderline personality disorder, commonly known as BPD, has a rich and complex history that spans several decades. The journey to understand BPD began many years ago, with early observations and studies that laid the groundwork for what we know today. In the early 20th century, doctors and researchers started to notice patterns of behavior in some individuals that didn't fit neatly into existing categories. These behaviors were often misunderstood and misdiagnosed, leading to a lack of effective treatment options. It wasn't until 1980 that BPD was officially recognized as a distinct mental health disorder in the Diagnostic and Statistical Manual of Mental Disorders, or DSM. This recognition was a turning point in the field of mental health. This was a major milestone, as it helped to raise awareness and pave the way for more focused research and treatment. The inclusion of BPD in the DSM allowed for a more standardized approach to diagnosis and care. Like any area of medicine, our understanding of BPD continues to evolve. Researchers and clinicians are constantly working to develop new therapies and improve existing ones. But with each passing year, we gain valuable insights into this complex condition. The ongoing research and dedication of mental health professionals are crucial in helping those affected by BPD lead healthier, more fulfilling lives. Decoding the signs. Symptoms of BPD. BPD can manifest in many different ways, making it sometimes challenging to diagnose. It's like a puzzle, where each individual may experience a unique combination of symptoms. Some common signs of BPD include fear of abandonment, a deep-seated fear of being alone or rejected by others; unstable relationships, intense and often chaotic relationships, marked by idealization and devaluation of others; unstable self-image, a shifting sense of self, with difficulty defining personal values, goals, and aspirations; impulsive behaviors, engaging in risky or self-destructive behaviors, such as substance abuse, reckless driving, or binge eating. Remember, these are just a few examples, and not everyone with BPD will experience all of them. Feeling overwhelmed? You're not alone. If you're reading this and some of these symptoms resonate with you, it's important to remember that you're not alone. BPD is more common than you might think, affecting millions of people worldwide. It's estimated that around 1.6% of the adult population in the United States experiences BPD at some point in their lives. That's roughly 1 in every 60 people. The good news is that with increased awareness and understanding, more and more individuals are seeking help and finding effective ways to manage their condition. Section 5. Navigating relationships with BPD. One of the most challenging aspects of BPD is its impact on relationships. Individuals with BPD often crave close connections, but struggle with intense fear of abandonment and a pattern of unstable relationships. Imagine a delicate dance where one partner yearns for closeness while simultaneously pushing the other away. It's a difficult cycle that can lead to misunderstandings, hurt feelings, and broken bonds. However, with open communication, empathy, and a willingness to work together, it's possible to build healthy and fulfilling relationships. Section 6. BPD around the globe, a shared experience. BPD is not limited by geographical boundaries or cultural differences. It's a global phenomenon, affecting individuals from all walks of life. While the prevalence of BPD may vary slightly across different regions, studies have shown that it occurs in countries all over the world. This highlights the importance of raising awareness and promoting understanding on an international level. Just like the human experience itself, BPD transcends borders, reminding us that we are all interconnected and that mental health is a universal concern. Section 7. Finding hope and healing. Treatment options for BPD. The journey of healing from BPD is often a marathon, not a sprint. But with the right support and treatment, individuals can make significant progress in managing their symptoms and living fulfilling lives. One of the most effective treatments for BPD is psychotherapy, also known as talk therapy. This involves working with a trained mental health professional to explore thoughts, feelings, and behaviors, and develop healthy coping mechanisms. Medications, such as mood stabilizers or antidepressants, may also be prescribed to help manage specific symptoms like mood swings or anxiety. Section 8. Taking charge. Self-help strategies for BPD. In addition to professional treatment, there are many things individuals can do on their own to manage their BPD. These self-help strategies are designed to complement therapy and medication, providing a holistic approach to mental health. These self-help strategies can empower individuals to take an active role in their recovery journey. By incorporating these practices into daily life, individuals can build resilience and improve their emotional well-being. Some helpful self-care practices include mindfulness and meditation, which are techniques to focus on the present moment and calm racing thoughts. These practices can help ground individuals and provide a sense of peace. Techniques to focus on the present moment and calm racing thoughts. Regular exercise is another crucial self-care strategy. Physical activity can boost mood, reduce stress, and improve overall well-being. Physical activity can boost mood, reduce stress, and improve overall well-being. Healthy sleep habits are also essential. Getting enough restful sleep is crucial for emotional regulation. Getting enough restful sleep is crucial for emotional regulation. Journaling is another effective self-care practice. Writing down thoughts and feelings can help process emotions and identify triggers. Writing down thoughts and feelings can help process emotions and identify triggers. Additionally, engaging in activities that bring joy and relaxation, such as pampering oneself with a face mask or taking a bubble bath, can be very beneficial. Remember, self-care is not selfish. It's an essential part of managing BPD and living a healthy life. Taking time for oneself can lead to better emotional stability and a more fulfilling life. It's an essential part of managing BPD and living a healthy life. By prioritizing self-care, Individuals can create a balanced and nurturing environment for themselves, fostering long-term recovery and well-being. Section 9. You are not defined by BPD. A message of hope. If you're living with BPD, it's important to remember that you are not alone, and you are not defined by your diagnosis. BPD is just one aspect of who you are, and it doesn't have to control your life. With the right treatment, support, and self-care, you can overcome challenges, build healthy relationships, and achieve your goals. Remember to be kind to yourself, celebrate your strengths, and never give up hope. Section 10. Thank you for listening. Together, we can make a difference. Thank you for taking the time to learn about borderline personality disorder. By increasing awareness and understanding, we can help reduce stigma and create a more supportive environment for individuals living with BPD. Remember, you're not alone in this journey. Together, we can make a difference.